doula. Ooh.
Well, thank you.
There we go. Zoom was doing something strange. Okay. Hello and welcome everyone to our discussion on medical racism under COVID. I am Cassandra Osei, PhD student, public speaker, and passionate researcher on all things related to the social determinants of health and maternal health. Today, I'm joined by Dr. Deirdre Cooper-Owens and Kataali Woods. Thank you both for joining me in this Hoodoisie virtual conversation. Deirdre is a wearer of many hats. Primarily, she is the Charles and Linda Wilson Professor in History of Medicine at the University of Nebraska-Lincoln, and she also directs their Humanities in Medicine program. In addition, she is the Director of African American History at the Library Company of Philadelphia, which is the oldest cultural institution founded by Ben Franklin in 1731. Lastly, she calls Lincoln, Nebraska and Brooklyn, New York home with her husband and cat. She has dedicated the past few years of her life to educate and speak about the history of reproductive medicine in America and to impact policy, particularly around issues of biomedical ethics. Next, Kataali is a wife and mother of 4 living in Houston, Texas. She too is a wearer of many hats, and when she's not busy tending to the needs of her family and community, she is walking completely in her purpose as a full-spectrum revolutionary doula and herbalist. She uses her training in African and African American traditional practices to center her care around the needs of Black and Indigenous woundbearers. She's focused on decreasing the maternal mortality rate in her community while providing opulent birth support services through her company, The Birth Altar. Thank you both for joining me today once again.
Thank you for having me.
Thank you for having me.
So let's go ahead and jump right in. Deirdre, can you lead us into a conversation with an overview of what medical racism is for those who may not be exposed to that term or experience?
So medical racism is comprised of a number of things. So there are individual instances of medical racism where someone can be racially discriminatory. There are structural issues, and that tends to be what I focus on. What are the structures of oppression within this field? And so much of what we now term American medicine was built in a colonial enterprise, and then one where slavery thrived and the oppression of different groups of people. And so many of the technological surgical advances that took place in this country and really put America on the global map in terms of the medical landscape happened because of medical experimentation with enslaved people. So already the foundation is a little creaky, right? Because you're essentially experimenting on people who are defined legally as movable property. And so like, consent and ethics are not really given towards those people because they are legally owned by others. So medical racism is long, it's deep in this country, it's based on systems of inequality, and it tends to be determined by negative social determinants. So environmental racism, lack of access to good and good quality healthcare, medical treatment. It is based upon systems that were exploitative. And so the ways in which it then comes out is through the disparities that we see most typically in studies that deal with Black people and white people in the United States. So Black people tend to live less. Black women die at higher rates, so really high maternal morbidity rates, high infant mortality rates. This cuts across class. We are literally, when I say we, Black people are literally the only group in the US where our educational background, our income does not protect us in the ways that other group members are protected by those things. So you tend to find the same alarming numbers and statistics no matter who the Black person is. We get higher diseases and infections that are preventable. So medical racism is essentially systemic, it is structural, and it is a public health crisis and has been since the start of this nation.
Thank you for that. And Kataali, as a full spectrum revolutionary doula, what does it look like for you to navigate medical racism with clients? And what methods have you used to ensure client safety?
It's a complicated task to do when you have to consider, you have to completely remove your own emotions and the things that you do know about medical racism and the history of this country. For me, I have to stay focused on my client, and there's a lot of personal, we have our own communication. So when it comes to being in a hospital setting, it's establishing a relationship with the doctors and the nurses in a way that we understand each other and we understand that we're working for a common goal, which is to see to it that my client and her child is safe. They receive the care that they should have, as well as any dangers or any issues. We communicate those in a way that is respectful to all parties, so that the common goal of bringing the child into this world safely and making sure that the mom goes home and is able to enjoy this new journey that she's been thrusted into is not riddled with possibilities of her being a statistic when it comes to Black mortality. One thing that I have learned to do with my clients is for us to have our own form of communication, especially within a hospital setting, when it comes to certain procedures needing to be done and there being a discomfort there. There are certain things that we do, and there are certain code words that I use speaking with not only my client, but as well as the doctors, so that they understand what my client does not want to do, what they are okay with. That way there's no discrepancy in what is happening. So if my client chooses to say no, I am certain in my communication with the doctor that there is no confusion and that we will not move any further. It's a lot of knowing how to speak up, understanding that what the common goal is, and still being respectful and professional in a setting that is not always accepting of doulas in general, especially not doulas of color. And it's navigating a system not meant for us, and trying to navigating it in a way that there is no trauma or there is no further trauma. And it's not an easy task to do. And sometimes it's really hard to swallow your own emotions and your own feelings of what you know is happening. But when you're trying to make sure that your patients or your clients are taken care of, you learn how to do it. It's a language of its own. It's a complete language of its own, navigating medical racism under the umbrella of birth, and seeing to it that things go smoothly and are handled in a way that's appropriate and promotes life and not death.
Thank you for that. So, given this topic, we know that COVID has unearthed a lot of the structural disparities that exist in our medical system, such as victim blaming of Black women and the stereotypes that are used to define their bodies. COVID has also enforced, or rather reinforced, patterns of isolation where Black women are birthing alone or Black women are seeking care alone. So can you both discuss the problems associated with the enforcement of isolation, how it further instigates medical racism, and also if you can explain potential solutions for this isolation? And I'll start with Deirdre.
That is such a great question, and not because the subject matter is great, but I think it's one that leads us to a discussion about kind of what is going to happen in the post-COVID-19 moment. And so I'm a historian, so I'm always thinking about the ways that this is not necessarily exceptional. And so I'll start with this moment of Black people's movement, largely within this space that we call the United States, has almost always been dictated, except for the last half, of the 20th century until now. Legally, I'm saying, it has been dictated by the state or people who own them. So I tend to give this example. if you were born into a historical setting where your body is owned by someone else, that means that even in the moment of birth, you don't necessarily have the power, the political power, or even the autonomy to be able to touch freely, because your body isn't your own. And the body that you just birthed is not yours legally. It is considered a piece of property, asset, or capital. And so it becomes legislated by whoever is in the room who has the most power. So whether it's the owner or the medical doctor, a white person, a male, a property owner, you can go on and on. So when you come from a history where literally touch, the very first language that babies and their parents speak to each other, when touch becomes politicized and based on hierarchy, it's really tough in this moment when you know that quarantining and social isolation can help to save your life. You're still feeling like in some ways the state or the powers to be are intervening in telling you, right, that you have to isolate or quarantine. And so emotionally, that's tough. And so I really think outside of this moment, when we are dealing with the after effects and the afterlife of COVID-19, we are going to need so much emotional care and so much emotional therapy. And so I think the ways that we can do this is to continue to build community, to continue to express love in dynamic and even more creative ways. I think about at the start of this, when DJ D Nice just decided to do what he does, right? Just play music. And so for a medical practitioner, we might say, oh, that's music therapy. But he gave the gift that he knows best, right? And so because he knows music calms and heals and can trigger good memories. And so I think we have to be creative in our love language with each other in this way, because it's going to help with isolation. It's going to help with those feelings of being alone. But how do we do this collectively? I think I don't have the answers to that. And so we'll need to enter into some conversations, but I think building community is a wonderful way to start that, and making sure that when we impress upon people the need for political power, it includes community building.
Kataali, could you respond to that, please?
I think Dr. Owens really hit the nail on the head, is community. And that needs to be the center of what we focus on, especially during these times. And we've started it, but I think it's important even post-COVID that we continue to do so and continue to nurture relationships with those that we may have, we don't know personally, but we know through online platforms. Speaking from a birth and doula perspective, a lot of what has been going on is that we have offered virtual doula support because a lot of hospitals are not allowing extra support. Often they are not even allowing their husbands or their significant others to come into the space with them, even for checkups, even during delivery. So it was really important for my community as doulas to offer virtual services so that they are still getting what they need and they don't feel so alone. No, it's not that physical, in person, I can touch you, you can touch me type of relationship, but you still know that we're there and we're going to support you through it. It's also being willing to open up, because I think so many of us are afraid to share ourselves. So it's really important, because we don't know if you're dealing with something or if you're struggling with something if you don't vocalize it. So again, that takes you back to community and being willing to speak out and say, hey, I'm having a really hard time when it comes to pregnant women. And a lot of times they don't know what's going on or they don't know what to expect. So it's reaching out to people that you know and being willing to bring forces together. DJ D Nice did an amazing thing because music is healing. And I think it's important for people to really tap into their gifts and offer that to the world. Because even though we're distant from one another, we can still be a community in one. So it's absolutely centering back to community, being open and open enough to display your gifts and giving other people the space to do the same thing. And when it comes to fixing it, I think, like Dr. Owens said, is opening the doors for us to talk about it and keep the conversation going until we come to solutions that are going to help us as a community, and not forgetting about it because life has essentially gone back to normal, because oftentimes we do that. It's easy to know what to do or to come up with creative ways to do things in the middle of a pandemic or in the middle when you don't have any choice. The key will be to keep doing what we've been doing after life has gone to what we would consider normal, so that we can then start to figure out how, okay, we have the community part. How do we start to tear down certain things that are not keeping us viable, that are not allowing us to flourish?
Excellent. You certainly brought up a very interesting point, or rather question in my head, which is there normalcy in a world of structural violence? And that's certainly something to consider as this conversation goes on. And that transitions me into my next question, being that Black women, and I use that term broadly to also capture trans women, they undergo their own form of structural violence. And if not at the hand of the medical system, it's certainly at the hands of the justice system. Yet the intersectional nature of our disparities is often hidden. So as a scholar, Deirdre, how do we change that status quo and resist silence in our academic silos when it's time for action? And I'm speaking to you also as an academic as well.
Yeah, this is an interesting question, because I was on another, these are critical conversations. And so I was on another one, maybe, I don't know, late March or so. And Ruha Benjamin, who is a Black woman who does history of medicine and technology, science and technology. And she started with this question, like, do we want to go back to normal? Because that's the thing, what we were actually resisting and fighting against and trying to dismantle, I think in all the ways that even the three of us represent in our own different lives, professionally, personally, is like, we don't think the normal is good, right? We don't want to exist in that space. And so in many ways, we're either going to have to transform or totally dismantle what normal means, because it's not healthy, it's toxic for us. For me, as an academic, what I have to do certain things because it's the bread and butter. Like if I want the lights on and I want to eat and all of those things, I'm going to have to teach class. I'm going to have to do research. I'm going to have to do, all of the things that are set up for professors. But what I've been able to do, thankfully, because of kind of the longevity I've had, and also the recognition of my work by my peers, I've been able to do certain things where I'm saying, you know what, how can I, because institution building is very important to me, how can I, in my little teeny small way, in the little corner I occupy, in this world, how am I able to effectuate change, even if it means on the micro level? So I tend to do all of my community engagements with Black people or women identified people. I do that for free. If someone wants to give me, we still want to pay you $200. I'm like, you know what, just buy my books and then give it to your members. I don't care how you give it to your members. I do that. When I am going to schools and I'm keynoting, and I know, for instance, they don't use Black vendors, I'm saying, instead of taking me out to the fancy restaurant that you want to brag on because they got 5 stars or whatever that James Beard rated, I was like, do you have any Black-owned businesses that we can support? Do you have any women-owned businesses that we can support? And so they're scrambling to try and find them. That's where I prefer to go. And if it's a Black-owned business, I will say to them very directly, they're not going to tell you this, but you now have a professional relationship with this institution. You can consider yourself a vendor. When it's time to put in bids, do so. So those are the kinds of things that they might not be earth-shattering, but in some ways, how do you politicize even going to dinner? How do you politicize someone who only has $75 to give you? So those are the kinds of things. If you get a big honorarium, should a percentage go to a community group, based on the very thing that you're talking about? So I try to do those kinds of things to go against what academia really is about, or at least the beginning origins. It was really elitist. It was really masculinist. was really Eurocentric. And so in my work, I center Black women, I center Black birthing people, I center the enslaved, I center their descendants. I, speak to the public in different platforms. So whether it's social media or public speaking. So those are the ways that I am constantly trying to work against the elitist nature of this institution.
Mm. Thank you. And Kataali, as a doula, how do you resist whiteness in our spaces of healing and resist the fear of worrying about what white people think when it's time for action?
I'm very adamant about being okay with saying you are not wanted in this space, whatever space that is. And that's one of the things that has never been a problem for me. And I think it is to my advantage that I am very vocal about where I stand in my community. And I've had spaces where I specifically said, you are not welcome here. The space is not for you. And I'm not willing to open this space up for you. When it comes to shutting, like, there's really no fear. Like, I have no fear when it comes to saying what I need to say. I have no fear when it comes to speaking the truth and the truth of the enslaved and how what they have endured affects us to this day. One of the things that I think we try to do in my community of doulas is that we are trying, because being a birth worker is centered around women, period. And I think it's hard sometimes to say, I want to focus on Black and Indigenous women and Woundbearers. But when you look at the numbers and you understand that the odds are stacked against us, for me personally, I have no choice but to say, these are the women that I want to focus on. Will I serve a white woman? I absolutely will. But my focus and where I'm putting my attention, and when it comes to the work that I do within their community, is going towards Black and Indigenous women. I have no problem speaking up about that. I have no problem helping people find their voice when it comes to their space, and not and when it comes to their ability to have a space where it's simply for us, and they don't know how to verbalize or put into action saying this is only for us. I'm really good at that. So I have no qualms about centralizing the attention, the healing, the help on us. And I have no problem, I don't want to say shutting white people out, but that's what it is. This door is closed, and this is what it's going to have to be, because they need my care. They need my attention right now. And the healing that is required cannot have you in this space, because it can be traumatic, and we are trying to step away from the trauma. We're trying to heal from it. So I center my thoughts, even if there's a voice that's like, maybe you shouldn't, I center my thoughts around the healing and the work that I'm trying to do for my community, and everything else has to take a step back.
So when we're talking about healing, we know that the medical experience can certainly extend outside of the formalized medical center. And a prime example of that is the birth justice work that you do and that other doulas and midwives do. However, much of what is still missing from the medical experience is the human. And as the pandemic continues, my fear is that those disproportionately impacted will become statistics framed by this idea that it's individual poor choices that led to certain COVID outcomes. So how can we work to humanize medicine and the medical experience, the data that surrounds it, and also reframe it as important as actions such as voting and addressing police brutality? And I'll start with you, Kataali, in answering that question.
We have to dismantle the system. The medical system, the practices that are currently in place are based on what was taught and through the slavery. And I do not think that it is going to ever be a space for us until we completely tear down everything that was that was built surrounding the work that was done on Black bodies. Anything outside of completely tearing that down is just simply putting a Band-Aid on it. And it's not going to work. The only other option is for Black birth workers, Black midwives, Black doctors to open up their own practices and open the doors to us so that we have our space to go. Where the medicine that is being practiced there is centered around us and our needs. I don't know any other way other than tearing it down and starting over. I don't know if that is even possible. If we're speaking in terms of what's the easiest way, I believe that it will be important for us to start having our own practices. I don't know the best way to answer that if it doesn't include completely starting from scratch.
Oh, I think what Kataali said is right on the money. It's it has to be about institution building, but it also has to be about Black people who are dedicated to reproductive justice and birthing justice, because many of us have accepted oftentimes the anti-Black, anti-ideologies and lessons that have been taught, about poor people or queer people or, immigrant people, and we can go on and on and on. So it has to be about how can we all unlearn our biases so that we are working towards complete and whole health and quality of care and health and what that really means. I think that, it's so multifaceted. I think that in our earlier conversation that wasn't recorded yesterday, I talked about positioning and really privileging love as, a foundational framing for what we do. And the one thing about love is no matter how people try to frame it, love just is, it's not tough, it's not brutish, it's not any of those things, it's just love. So love is really about justice and caring for others. And so to have that as a political and physical framing when we're talking about health care, because there are so many people who get treated, but they're not cared for. Being able to institute touch back into the healing process. I underwent IVF twice in New York, in Manhattan, and then I later settled on a place in Queens. But it was always interesting to me in Manhattan, I was never touched without the aid of a tool. And so, you would have to have these diagnostic things done to assess, well, what's wrong, or, whatever it is. But I remember the first time I was actually touched in a caring and intimate way was I had gone through a really painful experience trying to dilate my cervix without anesthesia. And when I had to go over for the HSG, which is a test so that the X-ray can see through the dye that's injected into your body, if there's anything wrong. And I remember, I guess I looked so shocked and I was just, distressed. It was a Black nurse who literally read my face and began to just touch my arm, just exhibit humanity, touch my forehead, talk to me. And that's often missing because, the medical establishment is an industry. It's a capitalistic enterprise. It is exploitative in terms of labor, so the people who often do the hardest, dirtiest work are the CNAs, the techs, those kinds of folk that we don't tend to think about because it's binary for us to see the medical doctor or the nurse, and we forget about everybody else who works there. So, when you have an industry treating people, sometimes the care is taken out because this is also a litigious society. People sue. So I understand, it's like I said, I understand all the different layers, but if someone has just gone through a cervical dilation without anesthesia, there should at least be, if you can't touch because of legal reasons, there should be care in your voice. There should be love and empathy in your voice. And the fact that in Manhattan, in this really prestigious place, the only person who could show me that was a Black woman was really telling for me and to me. And so I think if we are establishing these kinds of relationships and in these kinds of centers and these institutions and organizations, we have to be able to incorporate that again. So that's why I'm so encouraged by Black midwives, Black doulas, who are out literally doing this work against the system. I mean, their very existence is against the system that wasn't created with them in mind. And so, you know, I'm not putting the onus on them. But what I'm saying is we could at least use what they're doing as a blueprint and a template.
Thank you. And I do have a follow-up question to that. When we're using what Black midwives and doulas do as a blueprint, and when we're talking about dismantling systems and institution building in unique ways for us, how do we do so in a way that prevents us from, you know, redoing what enslavers did? How do we prevent, you know, rebuilding institutions that harm us because we're kind of trying to, we're so brainwashed by what systemically is in place that we want to recapture it in something new? How do we prevent that?
I'm going to defer to Kataali because you are the ground. I mean, you're doing it. You know, I write about it. I write about observations, but I'm not on the ground doing that kind of important work, critical work.
Okay. So one of the things that I'm really big on is body autonomy and Woundbearers listening to themselves. One of the things that the women who were enslaved, they weren't allowed to process what was happening with their bodies. They weren't allowed to listen to their intuition, say, this is what's going on. Because if you let your intuition lead, you'll hear what's going on. They weren't afforded that opportunity. So for me, it's going back to before slavery and the things that we used to do, because we were a community-centered culture. Our culture was centered around, if something was going wrong, we all come together. So it's even before COVID, hospitals were isolated in how they treated their patients. It's taking that away. There is no isolation. We work together. We are going to communicate about what you're feeling. What do you think is wrong? Of course, you know, midwives and doulas, we have certain training, we have certain information, but that doesn't put me above the client because that's their body. They know what's going on. They know when something isn't right. So it's centering them in their care. This is what I think is going on. These are my suggestions. How do you feel about these suggestions? What can we do so that you are comfortable with the choice? This is the information. It's also about giving them evidence-based information so that they can, information and resources. So, hey, I'm going to tell you this. This is what I know to be true. Here are some resources that you can research for yourself so you can make an educated decision on what's happening with your body. That is going to be really important. I also think, and this may seem like something small, but completely taking away this uniform, these white coats, this thing, because it's intimidating when you walk into a room and everybody has all white on and these badges all over themselves, and you immediately feel like you are less than and like you don't know as much. And that hinders your ability to hear what your body is saying. I need to be I'm in a t-shirt and some sweatpants, not unprofessional. I'm still clean. I'm still put together. But you need to understand, I don't want anything to distract you from your ability to be able to hear what your body is telling you, from what your intuition is telling you. And then we can move from there. It's not copying the medical system. It's completely taking that out of out of what, that's no longer a blueprint for us. When we're moving forward and working with specifically Black women or womb bearers, we can't do what the hospitals have been doing. We have to do essentially the complete opposite. We have to listen to them. We have to include them in their care. We have to talk to them all of the time. We have to get permission, of course. Is it okay if I hug you? Is it okay if I touch you? Is it okay if, what do you want to be called? How do you want to be approached? Make them feel included in their care. It's not just, this is what it is, this is what we're going to do, and then keep it going. We can't. It's a stifling when it comes to being professional. You stifle your own intuition as a doula, as a midwife. You're not able to hear the client. You're not able to hear what they're not saying, but what they want to say. So as much as we need to build a space for the client to be able to listen to themselves, we also need to build a space so that we can hear what's not being said. It's going back to tradition. Honestly, it's going back to what our ancestors did before, what our grand midwives did. They didn't have all of these hospitals, and they came with their medicine bag and they knew exactly what to do, and they listened, they paid attention, and they were attentive, and they were loving, and they fed you and they held you. It's the matriarch of it all. You have to take patriarchy out of all of this in order for the Woundbearers, for the women to get what they need. Otherwise, you are going to continue to perpetuate what has already been done. And it's just going to be a cycle. And that's madness at best. And chaotic. It's not going to work. So we need to take patriarchy out of it. And we need to get back to the matriarchs. And we need to get back to allowing these women or these womb bearers to listen to themselves, because their bodies will tell them. That's like, I'm a big proponent of not pushing. Not pushing. You don't have to try that hard to get the baby in there. You don't have to try that hard to get the baby out. Like, relax. Your baby is going to come out. It's going to slide out just like it needs to. Your body was made to do what it's doing. Let it do that without all of this extra push, count to 10. No, let the body work. Let the human brain work. Let intuition work. Let everything that you know to be true about yourself work, and trust that you know yourself. No doula, no midwife, no doctor can tell somebody about themselves at all. So why are we assuming that position? Because we have training? We don't have training with that particular person. We have basic information that we can use to assist in what that person already knows about themselves. Trying to push that as law is really unnecessary, and it doesn't promote autonomy at all. You can be as kind as you want to, but if you're not listening, you're taking their autonomy away, and that's unacceptable to me.
That's powerful. Thank you both so much. Do you have any, as we close out this conversation, do either of you, and I'll start with Kataali here, do you have any final thoughts or takeaways that you want to share, and how our viewers and listeners can keep up with your work?
You know, this experience really stretched me, like the questions. Now I have to go back for myself, because sometimes you think you know, or you think you have a portion of the answer. And even now, going back to some of the questions that you asked, I now have to reconsider that in my own practice. It's going to broaden the part that I play. So I don't have any questions. I do want to thank you for the questions that you asked, because now it's going to force me to really, really stretch myself, because my focus is community and what I can do to make their experiences better, what I can do to see to it that the life that they bring into this world is not brought into this world in a traumatic way. So I appreciate you for the question. I'm really busy on Instagram right now, and my Instagram handle is The Birth Altar. I am also on Facebook, same name, The Birth Altar. Right now, I am working on just collecting resources for women in my community, as well as women that I know online who need help, who need services, who may not be able to get doula services. So I'm centering around right now collecting resources, monetary, tangible, diapers, clothes, things of that nature, to just help those who are in need, especially during this time where COVID has completely shattered people's ability to bring in money, to get the things that they need. There are a lot of mothers who are struggling to have the basic necessities for their children. So I'm focusing on getting help for that. There are also pregnant mothers who are not able to get doulas. So I'm working with other doulas to provide services, or a way that we could provide services so that so they get the care that they need, but it's also sustainable that way, because in my practice, I'm not just offering support on the emotional level. I'm also offering herbal help and a few other things. So it's not just physical and emotional support. It's herbal support as well. It's aromatherapy, it's Reiki, it's a whole plethora of services that I offer. So me and a few others are just trying to create a collective that will allow us to be able to sustainably offer our services, either for free or at discounted, or on a sliding scale.
Yeah, thank you for this. It's been wonderful, because just kind of looking at the two of you and the three of us in the little boxes on Zoom is like tangible evidence that the path I've been on for the last 2 or 3 years is the right one, because I've always wanted to be able to take what I do in the classroom outside of the classroom, because that's really politically important for me and culturally important for me. So thank you for the opportunity. And Hoodoisie, I hope I'm pronouncing that correctly, but I just thank them as well. And it's wonderful meeting and seeing you too, Kataali. So the takeaway for me is removing trauma out of reproductive medicine, following the lead of those who are involved in reproductive justice and birthing justice, because they have not messed up yet. So I'm like, if they're doing the right thing, I think it is imperative that we look, we listen, we learn from them, and we follow the models, because it's not just kind of one way, but the models that they're setting forth for us. Also, this is something that I have started to do. It's not always my practice, but I want to become more conscious of it. Just leaving folk with the names of Black women, either controlled, managed, identified organizations around these issues that need our support. So I'm thinking about Ancient Song Doula, which was for a very long time, literally a few blocks away from where I lived in Bed-Stuy in Brooklyn. So Ancient Song Doula. I know in Houston, I hope I'm getting it right, there's the Birthing Center, either the Birthing Center or the Birthing Place, but you can Google it. And a Black community in Houston, Texas. The Black Women's Blueprint, I think, is really important. Tanya Fields, who does the Black Feminist Project. And then, of course, there's Sister Song, which has been out here for a really long time, putting in the work, when they were kind of one of the very few organizations, exclaiming that we need to have reproductive justice. So I think it's really important to, write a check, do a cash app, volunteer your services, whatever it is. But these are people who have dedicated their lives, both personally and professionally, to saving our lives and ushering in new lives that are healthy and whole. So if we can support them, that would be wonderful.
Thank you both so much for your time and your wisdom shared today. And Deirdre, you didn't plug this, but your book, Medical Bondage, it's important.
That book as well. You can go to University of Georgia Press, their website, put in medical bondage, it'll pop up. You can get all different kinds of versions. So yes, thank you so much.
Yes, it is very important that we certainly continue this conversation outside of our little bubble here and extend it out to the academic researchers and the doulas and midwives abroad in this country interested in continuing this work. Thank you once again, both of you, so much. I appreciate your time.
Thank you.
Thank you.